Hello everyone, my name is Lucian Alfanti and how are you today? I hope you all in a good condition. Here I'm going to explain about the psychotic disorder, or we can call it as a psychosis. First of all, do you know about the psychotic disorder? Or have you ever heard about this mental disorder? Yup, the psychotic disorder is a severe mental disorder that causes an abnormal thinking and abnormal perceptions. People with a psychosis condition can lose touch with reality. When a psychotic episode occurs, people become unsure what is real and what is unreal, so they can't differentiate it. They usually experience hallucinations, delusions, strange behavior, chaotic speech, and incoherency. However, two of the main symptoms of this mental disorder are hallucinations and delusions. Then, what is the difference between delusion and hallucination? Delusion is false beliefs, such as thinking that someone is plotting against you or the TV is sending you a secret message. It's something like that. Meanwhile, hallucination is false perceptions, such as hearing, seeing, and feeling about someone or something that is not exist. So, people behaving in this manner are often referred to as being schizophrenic. And other possible symptoms of the psychotic disorder include lack of interest in personal hygiene or activities, problem at school, work, and any relationships, cold, detached manner, with inability to express an emotion, and mood swings or any mood symptoms such as depression. Actually, people don't have the same symptoms, and it can change over time in the same person. Then, the cause of the psychotic disorder is doctors don't know the exact cause of the psychotic disorder, and researchers believe that many things play a role as a cause of this mental disorder. Some psychotic disorder tend to run in families, which means that the disorder might be partly inherited, and other things that may influence their development, including stress, drug abuse, brain tumors, brain infections, and stroke. Then, how to diagnose the psychotic disorder is doctors will take medical and psychiatric history, then possibly perform a brief physical exam. So, the person might get a blood test and sometimes brain imaging, such as MRI scans, to rule out physical illness or drug use like cocaine and LSD. If the doctor finds no physical reason, so they may refer the person to a psychiatrist or a psychologist. These mental health professionals will use a special design interview and assessment tools to decide whether the person has a psychotic disorder or not. Then, how to treat the psychotic disorder is most psychotic disorders are treated with a combination of medications and psychotherapy, with types of counseling. However, the treatment depends on the cause of the psychotic disorder. It might be involving the drugs to control the symptoms and therapy. Hospitalization is an option as well for the serious cases where the people might be dangerous for themselves or others. Next, the types of the psychotic disorder. Do you know what are the types of the psychotic disorder? There are some types of the psychotic disorder, such as schizophrenia, schizoaffective disorder, delusional disorder, brief psychotic disorder, and paraphrenia. However, the most common types of the psychotic disorder is schizophrenia. Patients with this condition experience changes in behavior, hallucinations, and delusions that last longer than 6 months. Those who diagnosed with this type of the disorder often show a decline in their social function, like school and work. Problems naturally occurring brain chemicals, including neurotransmitters that call dopamine and glutamate, it may contribute to schizophrenia. Neuroimaging studies also show the differences in the brain structures and the central nervous system of people with schizophrenia. While researchers are not certain about the significance of these changes, and they indicate that the schizophrenia is a brain disease. In schizophrenia, the experts also believe that the nerve cell receptors that work in a brain chemical, which is called glutamate, may not work properly in specific brain regions. So, that glitch may contribute on problems with thinking and perception. Those conditions commonly appear on people in their late teens, which is 20 and 30 as well. It tends to affect men and women equally. If you want to help someone who may have symptoms of schizophrenia, you must talk to him or her about your concerns. Even though you can't force someone to seek the professional help, you can offer the encouragement as a support and help for them to find a qualified doctor or mental health professional. If they pose a danger for themselves or others and they can't provide their own food, clothing, and shelter, you may need to call the emergency responders for help so they can be evaluated by a mental health professional. Next, there is factors of schizophrenia. Although the precise cause of schizophrenia is unknown, certain factors seem to increase the risk of developing and triggering schizophrenia, including first, having a family history of schizophrenia, second, some pregnancy and birth complications such as malnutrition or exposure to toxins or viruses that may impact in the brain development. And third, taking mind-altering, like psychoactive or psychotropic drugs, during teen years. There's also the complication of schizophrenia. Schizophrenia can result in severe problems that affect every area of life. Complications on schizophrenia may cause and can be associated including 1. Suicide attempts and thoughts of suicide, 2. Anxiety disorder and obsessive-compulsive disorder, or we can call it as OCD, 3. Depression, 4. Abuse of alcohol or other drugs, including nicotine, 5. Inability to work or attend school, 6. Financial problems and homelessness, 7. Social isolation, 8. Health and medical problems, 9. Being victimized, and 10. The last one is aggressive behavior. And the last point or the last part is the conclusion. There's no sure way to prevent schizophrenia. However, stick with the treatment plan can help to prevent relapses or worsening of the schizophrenia symptoms. Moreover, researchers hope that learn more about its factors and the cause of schizophrenia may lead to earlier diagnosis and proper treatment. I think that would be all of the information about the psychotic disorder, which is focusing on schizophrenia. Thank you so much for your attention. My sincere apologies for the mistake, and have a great day, everyone.